What's up, guys? It's Sydney and I'm here today with Dr. Matt Crandall, and today we're going to be answering your question, how do I get rid of my lower back pain? So pumped to have Dr. Crandall here with me today, and just to give you a little bit of background on him, he is a doctor of physical therapy and an orthopedic certified specialist who focuses on manual therapy and orthopedic injuries, mostly treating active adults and athletes, would you say?
That's right.
He's also a ex-college football player and still very active in our fitness community doing mixed martial arts and all kinds of boot camps every time we come to one of my boot camps.
That's right.
And so we've been talking the past couple months about how in both of our fields, in personal training and in physical therapy, the most common complaint that we hear is lower back pain.
That is right. And the fact is that 8 out of 10 people in their lifetime are going to experience low back pain. And most of the time these people don't know why it started and don't really know what to do about it.
Right.
Today we're here to explain some things that you can do to help prevent low back pain and teach you some stretches and exercises if you have had low back pain in the past or are currently experiencing low back pain.
That's right. So from a personal training standpoint, I'm going to have Matt demonstrate here a squat, and I'm going to kind of show you a couple things that I want you to focus on when you're performing any movements that kind of concentrate on your lower back. All right, so I'm going to have Matt stand here. He's going to stand with his feet just a little bit wider than hip width apart. In his starting position, he's going to want to make sure the torso is engaged. So he's got tight abs, a nice tight back. As he sits down into a squat, you'll notice that his back stays nice and flat, okay? There's no rounding of the spine, his shoulder blades are engaged, his core is tight, all the weight is back in his heels, right? He's gonna engage his glutes, keep his chest upright, and as he comes up, he's gonna keep that nice tight core, chest comes up at the same time as his hips. Okay, the improper way to do this, which is kind of how some people find themselves with lower back pain, is when he gets down into a squat, his back starts to round out a little bit. Okay, notice there's no flat line here. His shoulder blades are relaxed, his core is relaxed, and his lower back, when he comes up, is gonna take all of that weight. Now that you know a couple moves and how to squat and how not to squat and what to look for as you go through these movements, I'm gonna have Dr. Crandall take you through what your spine is actually experiencing as you go through them.
And I'm going to show you why this is important. So I've got a spine model here of somebody facing the same direction that I am. So your spine is made up of a series of bones and discs. Here, bone, disc, and you have nerves that exit the back here. The nerves are important because these nerves, they supply strength and sensation to your back and your legs. What happens is if we're losing that neutral position of our spine with exercising or movement throughout the day, these discs can start to get pushed backward and actually pinch on the nerves back here. So as once that happens, this nerve gets a little irritated, and first you have low back pain, but as it gets worse, you can start to get some shooting pain that'll actually go down your leg. What we're going to do next is I'm going to take Sydney through a few stretches and exercises that is going to help prevent this or actually fix this problem if this is going on with you. So the first exercise I'm going to show Sydney is called a prone press up. So I'm going to get Sydney here on her stomach. Lay on her stomach, she's going to get her hands underneath her shoulders so she's comfortable there. What she's going to do is she's going to press herself up as far as she can go. As she does this, she keeps her butt and her stomach nice and relaxed. She's going to exhale at the top and back down. She's going to repeat this, come on back up. She comes up. As she's doing this, she's feeling a good stretch in her back. She's going to keep repeating this motion as long as it's feeling good. The reason this is a good exercise for her back is because we live in a flex world. We are bending, we're sitting, we live in this position all day. Our back is never really getting extended. This is a great position for somebody who sits a lot during the day. The next exercise I'm going to have Sydney do, next stretch, is she's going to have her get on her back here. And this is going to stretch these glute muscles, your butt muscles. If they are tight, they can refer pain into the low back. So Sydney, I'm going to have you bend one leg up. You're going to take your knee and you're going to pull it towards your opposite shoulder. As she does this, she should feel a good stretch in her butt. She can also change the angle of this stretch. She can pull it up towards the same side shoulder, across, and it all depends on where she's tight and where she's feeling that stretch. It should be comfortable. She should be able to hold it for about 30 seconds without any pain. Come on down, that's it. Good, and I would just have her repeat this on the other side. Same thing, up towards the opposite shoulder, feeling a good stretch there, 30 seconds, and back down. Perfect. Okay, come on up here. So now what we're going to do is I'm going to also show Sydney a way that she can get in on the front side of her spine. You have some muscles that can get tight, these hip flexor muscles. So I'm going to have Sydney get on her stomach here. And we've got a dumbbell here. So for this mobilization, you're going to need a dumbbell or a kettlebell, something you can use to get in the abdominal muscles here. What you're going to do is she's going to find her hip bone and her belly button, and she's going to use this dumbbell to kind of give herself some pressure in here and soften these muscles up before we stretch them. So go ahead on your stomach here, and I'm gonna put this right down so you can find that position. So she's got her hip bone here, her belly button, and this is kind of laying right in there. So she's first gonna get comfortable in this position. Once she feels like she's relaxed, she can take her opposite leg, she's gonna bend her foot, and she's gonna push it up towards the ceiling. When she does this, she feels that in her stomach and back down. Same thing, she can repeat this. She can do maybe 10 of these, nice and easy. It should be relatively comfortable. It's going to be a little tender because these muscles don't get a lot of attention. Back down, good. Let's do one more good one. Up, and as she does that, she feels that side of the dumbbell. You could also use a towel or something to soften that up. It needs to be comfortable. She needs to be able to stay relaxed as she's doing this mobilization. That's gonna set us up for our hip flexor stretch that we're going to go into now. So she's gonna get on her one knee, and let's do the other leg here. Let's go here. So she's gonna stretch the same muscle that she did. She just mobilized. So as she does this, she's extending this hip flexor muscle, feeling a good stretch in her stomach. Same principles apply. She should be able to hold this stretch for 30 seconds without pain, nice and easy, and she's just feeling a good stretch in the front side of her hip there. Comfortable, back is nice and flat. 30 seconds, and relax. The last exercise we're going to show you is I've got 2 lacrosse balls here in a sock, and this is something that you can make at home to help kind of loosen up these muscles in your low back. So what I do is I take these 2 balls, and you can put them in any sock like this here. And what we're going to do is we're going to use these to kind of help loosen up these muscles in her low back. So on your back, you can kind of find where your spine is, and you feel those bones. These 2 balls are going to straddle that. So I'm going to kind of put them here. Sydney's going to lay back on her back. She can bend her feet up. She's gonna let them settle in, get comfortable first. So after she feels like she's comfortable, the balls are not digging into the bone itself, then what she's going to do is she can just rock her legs back and forth. Nice and easy. She should feel those balls kind of working out those muscles, some tension. If she finds a spot that's a little bit more tight, she can get in there and work that out a little bit. If one side was more uncomfortable, it's not wrong to use one ball on the left or right side, and then she can just rock towards whatever side that might be. So nice and easy. I wouldn't spend more than a minute or so. After she's done with this, she could sit up, she could turn around, do some more of those press-ups. She may feel a little bit more loose, feel like she's able to move a little bit further.
Cool. Awesome. Well, I hope you guys got a lot of great information out of Dr. Crandall today. A lot of great stretches if you have some lower back pain, because as we both know, it's so prevalent. In our professions, from a personal training standpoint, make sure you have a personal trainer who is very attentive to your technique and to your form, whether you're progressing in your fitness program, you're adding new workouts in, or you have some injuries or ailments that you need special attention to. Like
Sydney said, I hope this stuff helps. If you continue to have problems or pain or issues with any of this, it may be necessary to seek some professional advice. Some of the things that I would add are joint mobilization, soft tissue massage, dry needling, some neuro re-education, just to kind of get you moving better and get your body back to where it needs to be.
Thank you so much, Dr. Crandall, and I hope you guys enjoyed this Q&A with us. Let us know if you're having any lower back injuries, and if you have any questions for Dr. Crandall, leave them in the comments below. We'll be sure to get back to you, and if you have any future questions, also leave those in the comments below. Hope you guys have a great day. Make sure to click like and subscribe, and we'll see you soon.